Assalamu alaikum. You are watching Microbiology by Nouman. In this video, we will talk about Optochin test. Optochin test is used for the identification of Streptococcus pneumoniae, which is also known as pneumococcus. Also, Optochin test is used to differentiate between Streptococcus pneumoniae from Streptococcus viridans. But the question is why we need to perform this test. Because Streptococcus pneumoniae and Streptococcus viridans both are gram-positive cocci. Both are catalase negative and both produces alpha hemolysis on blood agar plate. So in order to differentiate between Streptococcus pneumoniae and Streptococcus viridans, we need to set certain criteria and perform certain tests to differentiate between them. Optochin test is one of the way by which we can differentiate between these two. But the question is how this test is performed and what is the principle of this test. In this test we use Optochin. Optochin is a derivative of quinine, it's a chemical. So if this Optochin drug is present, Streptococcus pneumoniae cannot grow. If Optochin is present, Streptococcus pneumoniae cannot grow. So we call Streptococcus pneumoniae as Optochin sensitive. In the presence of Optochin drug, Streptococcus pneumoniae cannot grow. Whereas Streptococcus viridans can grow in the presence of this Optochin. So Streptococcus viridans are resistant to this drug, right? So Streptococcus viridans are Optochin resistant, and if this drug is present, Streptococcus viridans can still grow. But the question is how this test is performed. In this test we use Optochin. This Optochin is diffused on a filter paper, or easy words, a very small filter paper of about 6 millimeter size, and on this filter paper this Optochin is diffused. So Optochin is poured onto this filter paper, and this filter paper is now called Optochin disc. This Optochin disc has a size of about 6 millimeter, a very small filter paper. And in this test we need blood agar plate, and on this blood agar plate we will make a bacterial lawn of Streptococcus pneumoniae. With the help of swab we will make a bacterial lawn. This is blood agar plate, and on this agar plate we will place this Optochin disc in the center, and then we will incubate this plate at 37 degrees centigrade for 18 to 24 hours in 5% CO2. After 18 to 24 hours we will see that on this blood agar plate, if this is the Optochin disc placed, around this disc there will be no growth, whereas all over the plate Streptococcus pneumoniae is growing. So this zone where there is no growth of bacteria is known as zone of inhibition. And this zone of inhibition, from this point to this point, or anywhere from this point to this point, should be at least 14 millimeter. So from here to here at least 14 millimeter zone of inhibition should be present. So we call Streptococcus pneumoniae as Optochin sensitive. Around this disc there is no growth, so Streptococcus pneumoniae as Optochin sensitive. Whereas if we take a plate of blood agar plate and on this agar plate we make a lawn of Streptococcus viridans, and in the center we place this Optochin disc. After incubation of 18 to 24 hours at 37 degrees centigrade and in 5% CO2, we see that this blood agar plate, on this agar plate, this is Optochin disc placed. Around this Optochin, there will be growth of bacteria all around it. There will be no zone of inhibition, right? Bacteria are growing all over it, all around this Optochin. So Streptococcus viridans are resistant to this drug. This Optochin has no effect on the Streptococcus viridans.